are impacting not only the state but the rest of our nation. 26% increase yesterday in the number of new patients with COVID-19. We now are seeing a spike that we were anticipating, that we were modeling, but that we were substantively preparing for. And part of that preparation is exampled with the ship you see behind me. The capacity of up to 1,000 beds within that ship at the peak consideration, about 550 at the lower end, and we could talk more about the operation and any questions that people may have. It's just one of many assets that we're already pre-positioning throughout the state of California. We now have identified 4 sites for the medical field stations. We are the beneficiary of 8 of those sites, 2,000 rooms. Because of the support of the administration, those sites are going up. 2 of them will be operational within the next few days. We are pleased to have procured hundreds and hundreds of hospital beds throughout the state of California. Seton in Northern California now is operational. St. Vincent down here in Southern California. We have procured the asset. Now we're working to get the resources, the personal protective gear, and the staffing to make that fully operational. We are in the process now of having secured roughly 4,000 beds of some type to prepare for the surge, which we believe will start taking shape in the next week or 2 based upon our modeling. We haven't been waiting, we have been preparing. And I could not be more pleased and proud of our hospital system themselves. They've begun to decompress the system throughout the state. That system has a capacity of 75,000 beds, 416 hospitals in the state of California. They've been reducing the number of patients in that system by eliminating elective surgeries, and because of our stay-at-home order and the incredible leadership at the local level represented throughout the state of California, we've seen a reduction in trauma-related surgeries and emergency department numbers. And as a consequence of that, we're not only surging our overall capacity in the state to meet the need going forward, but we've been able to reduce the current census within the hospital system also in preparation to meet this moment. That moment includes not only the physical assets and the human resources that reside here at the Mercy, but also making sure that we have appropriate personal protective gear. The state of California has already released throughout the system 31.7 million N95 masks. We now have procured, we have literally procured, it's in the system and is being delivered 101 million additional N95 masks. We have distributed 1.4 million sets of gloves. We have procured an additional 1.5 million sets of gloves. I could continue through coveralls and gowns, but you get the picture. This state is asserting itself, taking responsibility to meet this moment. We're not pointing fingers. We're not clenching our fists. We have our hand out absolutely to the public sector and the private sector. And I just want to reinforce the private sector. Elon Musk is a perfect example of that, procuring 1,225 ventilators and getting them out into our system. The ability and capacity for companies large and small, from Apple to Virgin to Facebook to Google and others that have stepped up to meet this moment. Airbnb providing now safe and clean assets so our first responders and our medical care providers will have a place to stay near, in and around their patients. Just examples, proof points of people stepping up and stepping in. We have roughly 4,095 ventilators that we've identified or already have in our possession. 815 of additional ventilators are being refurbished, so that's close to 5,000. Our goal is to get to 10,000. And while we haven't received any directly from the federal government, LA County did receive 170 directly, which certainly helps support our efforts, and we'll look forward to having more robust conversations to receive additional ventilators. We are running currently a hospital system that has today, in the census earlier this morning, 746 individuals that are hospitalized, 200 in the ICU. However, we have over 4,180 individuals, 4,180 individuals that are what we call PUIs, which are persons under investigation that are in the hospital system, but that have not been formally diagnosed as positive with COVID-19. And so that hospitalization number does not include the number subset of those that are awaiting tests. And we continue to make this point. And while we've all struggled across this country to get these RNA extraction kits, the reagents, and deal with the diagnostic side, we're also struggling with swabs and the media related to those swabs and the transfer of that media. And that remains an issue. But because of leadership of Mayor Garcetti, leaders of mayors across the state of California, our total testing numbers have increased significantly. Total tests in the state as of this morning, 88,400. It's over 10,000 tests every single day. But here's the problem, and it goes specifically to the issue of those persons under investigation. Those PUIs are waiting for test results, and in some cases, these test results are coming back 6, 7, 8 days later. We've got to increase our throughput, not only on the diagnostic side, on the testing, but ultimately getting those tests and that information back into the system, back into the hospitals, so that they can transport people, triage those individuals throughout the system and back out to the extent they're tested negative into community care. So we are making progress on every front. We're not waiting around. We don't believe our fate is predetermined. We don't think the future just happens. It's not something to experience, it's something to manifest. It's our capacity, individual capacity, to continue to make good decisions on physical distancing and continue to maintain our strict standards in the state of California as it relates to our stay-at-home orders that we must continue to advance. And if we do, we can bend that curve, we can meet that moment, continue hour by hour, minute by minute, to do more of what you see behind me in terms of laying the foundation of preparation as only this state can at this scale of responsibility and expectation, so that we can save lives and we ultimately can meet this moment working collaboratively and working together. I'll just close before I pass it over to Mayor Garcetti by just saying this: the spirit of collaboration, the spirit of cooperation is alive and well in this state. People, unprecedented number of people offering themselves to meet this moment in terms of procuring resources, but all with a deep resourceful mindset, and all of us deeply anxious in recognition of the nature of the number of tests that remain outstanding and the need to continue much more broad and detailed community surveillance, expanding our testing capacity so that we can really model our ability to meet this moment in a much more dynamic way, targeted testing, widespread testing, so that we can ultimately triage and move people throughout the system. That said, we have outstanding leadership, and one of those that demonstrably has met this moment and has been an incredible partner to the state of California is Mayor Eric Garcetti here in Los Angeles. There hasn't been a day where he hasn't reached out and connected with the state, again, offering a collaborative spirit, offering insight, advice, and counsel, and providing that to our team in real time. And I cannot say enough about his leadership at this moment, and candidly more broadly, and I'm pleased and privileged now to ask him to the mic and talk a little bit more about how he helped get this ship here and how he is responsible for this port and its operations, and how proud I know he is of the team that he has assembled. Mayor?
Usually we'd embrace, and this governor is not just California's governor, but he's become America's governor. The first governor to take the moves that we needed in this country and to lead the way. And as you can hear, with no notes and anything else, a man who is leading this state. And I just want to say on behalf of my city governor, and I know the mayors that I speak to every single day, that we are so proud to have you leading this fight with us and for you to be alongside. I also want to thank the governor for why the ship is here, and I'm going to get to the ship in a moment. But I know the conversations he had directly with our president and vice president is why we have today a ship that now will be the largest hospital in Los Angeles at its full capacity, and at its capacity today will add 1/3 more available beds, and at full capacity, 2/3 more beds to the fight here in Los Angeles. You know, we're used to having the Navy here in this port, America's port. This port is responsible for 43% of the goods that come into America by sea. It's good not just for California, but for this entire nation. And we know the Navy because this was a great Navy port. And each year we celebrate during our Fleet Week the amazing men and women of our Navy, Marines, our Coast Guard, who defend us every single day. In fact, just footsteps away from here is the USS Iowa, one of the most powerful symbols of this nation's might. A battleship that carried a president in World War II to meet with his allies, a place that today symbolizes our forward strength. But the strength of a nation isn't just the warships we have, it's also the strength and the capacity of the mercy that we give one another. And to have the United States Naval Ship Mercy here today, I want to thank the President, I want to thank our senators, I want to thank everybody who had a role. Our Supervisor Janice Hahn, our local council member Joe Buscaino, and everybody who made this happen. And it is docking here in a port led by Gene Soroka and Chief Gazy and our port police that is making sure that the men and women who are in there can focus on our health while we protect theirs. Here, this will be a ship that will take patients in, as the Admiral will say in a moment, I'm sure, this will be a COVID-19 free bubble. But by every person who comes in, whether transported from a direct accident or something like that, or from a hospital, every bed not taken in Los Angeles by the great work of the men and women here will mean one more bed for the surge that the governor spoke about. And so this truly is mercy on the water. This truly is mercy at the beds. This truly is mercy and the expression of who we are as Americans and as people at this moment. And I'm just so grateful that each one of us can step up at this moment and do something to help each other. I'll come back and say some words in Spanish, and I'll do my usual evening briefing, but I wanted to be here to welcome those men and women and to thank them and everybody who had a hand. But let me turn it over to Rear Admiral John Gumbleton, who's the commander of Expeditionary Strike Group 3. I served 12.5 years in the Navy, and in the Navy I once was able to get on board this ship. I saw what its amazing capacity is, and make no mistake, as the governor said, when my fellow sailors got that notice that they needed to get their sea bags, leave their families, leave their loved ones, and come here to take care of our city, Admiral, let me say how grateful all of us are, and that this is a ship that is full of angels in this city of angels. The Admiral has been in charge of all the logistics on the Navy side to make this happen, and let me turn the microphone over to him and say thank you on behalf of a grateful city. Admiral?
Thank you, Mayor Garcetti, and thank you, Governor Newsom, for having me here today. The men and women of the USNS Mercy in the United States Navy, we're honored to be here in Los Angeles, supporting FEMA, the state of California, and the city in this ongoing COVID-19 crisis. You know, the Mercy behind me is uniquely outfitted for humanitarian assistance and disaster relief. One of the Navy's core missions these ships perform around the world. Our embarked medical professionals are highly skilled and trained and ready to support COVID-19 response efforts. And as said before, by providing care to patients in need of treatment not related to COVID-19. In that regard, they will in effect serve as a relief valve, allowing local hospitals to increase their focus on treating COVID-19 patients. We're extremely proud to be part of this whole of government approach to response and to serve the great people of our nation, the state of California. And with that, I'll turn it over to the governor. Thank you.
Thank you, Admiral, and thank you to Captain Quinn as well for your extraordinary leadership. They'll be doing rehearsals, as they refer to them, this evening, and potentially taking patients as early as tomorrow. So when we say this is operationalized, we mean that quite literally, allowing us to decompress the west of the LA County system, which is beginning to see those increases that were projected in our modeling, and a disproportionate sum of hospitalizations that are occurring in this region in particular make the Mercy so profoundly important to meet the moment and provide capacity for our entire healthcare delivery system. With that, we're happy to take any questions from all the reporters that are here and those that we know that are online, appropriately socially distanced. So on the 16th of this month, the question is around evictions in the state of California, around renter protections. Many know that a couple of days ago we announced a deal with 4 of the 5 largest national banks in America around mortgage relief, forbearance of payments for at least 90 days. A few weeks prior, we had put out guidelines for cities large and small and creating a legal framework where they could put moratorium together related to evictions for rentals, for tenants. Los Angeles has been a leader in this space, San Francisco, San Jose, 30 jurisdictions had moved already or moved now more aggressively to establish the framework, but only 30. And as a consequence of that, today we just established a new overlay for the state of California that denies the capacity for enforcement, court proceedings for any evictions through May 31st. So for tenants, through May 31st, there will be no eviction proceedings. There'll be no enforcement as it relates to your inability to pay for COVID-19. It does not preempt any local ordinances that go deeper or farther, but it is an overlay for the entire state of California. So this is regarding the numbers today, 26% increase. And I should note, there are different sets of numbers that come out. Some people track numbers in real time and report them in real time. We've been very disciplined to put out numbers that meet an exact moment on a daily basis so we can confirm those numbers. 78 deaths, 26% increase from the previous day, 3,801 individuals that have tested positive for COVID-19, 88,400 tests, of which tens of thousands of tests are still waiting for results. And so I caution people as it relates to the numbers to consider the magnitude of the number of tests that have been conducted that haven't come back yet, so people have a better sense of what to anticipate. That goes to the question about, are we seeing the surge that we anticipated? Our modeling is moving as we expected, and we're seeing in Los Angeles, and Mayor could talk a little bit more about this. In fact, I'd like him to, because of the unique characteristics of this region and in this county, they're seeing surge numbers that put them on track within a week to be in line with where New York City currently is, if they see the kind of increases they experienced yesterday. But Mayor, maybe you can talk more specifically about that.
Sure, and I think while we've been here, the county may have put out new numbers. I know Dr. Galley is here from the county. Yesterday's increase, though, of over 50% would, of course, have a doubling rate of less than 2 days. By that measure, we would be where New York City is in number of cases per capita in Los Angeles County 6 days from now, or 5 days from now, 6 days from yesterday. We would be in a slower rate of increase the day before in 12 days where New York City was. So whether it's 1 week or 2 weeks, as I've been sharing, we will be where they are. We will have doctors making excruciating decisions. We'll be trying to figure out what we do with that surge, how to get ventilators, where to find beds, which is why it's such a great day, at least today, to know that the USNS Mercy is here. But that's the rate of increase that we're seeing right now in Los Angeles County.
And it just reinforces the point. Every minute is a minute lost unless we take advantage of the minute. Every hour is an hour lost. Every day is a day lost. And that's why I'm so pleased and proud of what's happening all across the state of California. Thousands and thousands of beds being procured, people coming back, annuitants that are retired coming back into the workforce, fourth-year medical students now saying, you know what, can you help license me temporarily? And I'm going to contribute to meet this moment. The PPE that we're trying to procure from every conceivable source, from every conceivable part of the globe, 101 million N95 masks that we were able to write a check for already that are starting to come in, getting these beds set up, getting the rehearsals done so they're operationalized. We are not waiting for the crisis to hit and then react to it. We're doing everything humanly possible to prepare, but our eyes are wide open in terms of the multiples and our capacity as a system to deal with a surge of what we anticipate may require 50,000 beds over the course of the next 6 to 10 weeks. Look, the hospitals are bearing a disproportionate responsibility, and that is to prepare for this moment and then to meet the surge. And as a consequence, their traditional payments that they receive through elected surgeries are down significantly or no longer exist. So they're in deep financial distress, and that's why we've all been sober. And while we're very pleased with the $2+ trillion stimulus from the federal government, none of us are naive that we're going to need more support down the line. Not only the states and cities, we have $15.3 billion that will come from the $2.2 trillion stimulus into the state of California, $6.9 billion for local jurisdictions like this. But it won't be enough. Hospitals will need that support, and the medical system broadly defined as it relates to our Medicaid system, our Medi-Cal system in the state of California. People that need treatment will get that treatment, and we will do everything in our power to make sure we're signing up people. We've extended our open enrollment. We believe, regardless of your status, that you have the right and we have an obligation to treat you and to take care of you. We'll assess those costs in real time, but our focus right now is less on economics in terms of those decision making, but on the health and safety of 40 million Californians. Yeah, the question of being able to recalibrate people's current status as it relates to being third or fourth year medical student. We've already in that process to expand their licensing capacity to meet this moment, looking at scope of practice broadly defined, which is a deeply controversial subject in any environment, including this environment. Those conversations are well underway. We've done surveys of hundreds of thousands of state employees. We have EMTs, we have paramedics, we have firefighters, first responders. We have people with expertise that we never even realized that are now offering up those expertise to recategorize their current job descriptions and make themselves available, not only from a medical surge perspective, but a specific example just to meet the needs of all the unemployment insurance claims in the state, which have averaged over the last week 108,000 a day, over 1 million people accessing or trying to access our unemployment system. We want to get those checks out as quickly as possible, and we're trying to meet that surge in the same sense of urgency, and that is reprioritizing, reconstituting our workforce, including all of those individuals that are currently preparing to enter into it formally that may just find themselves in the middle of this much sooner than they expected. Yeah.
I just want to add one thing to that very briefly. Since we asked for medical personnel 2 nights ago to sign online to a portal, doctors who are in offices that are closed, nurses that come back from retirement, et cetera, I'm proud to report we have over 2,000 people just here in Los Angeles alone that have offered their services, who are trained medical professionals. And I want to thank them. I know San Francisco has done something similar as well to enlist folks, and we've been working very closely with the governor's office on that. Thank you.
Over 2,000.
Yeah, so of the 50,000 bed surge that's part of our planning, 30,000 of those beds will come from within the hospital system and their footprint. And what I mean by that is extending their staffing capacity, repurposing their operating rooms to ICU rooms, putting tents up in parking lots, and providing a surge capacity that is equivalent to 40% of their licensed beds. Outside of that system, 20,000 rooms are being procured through the state, including the Mercy, which is 100% staffed by the contribution of the American taxpayer and the incredible men and women in uniform, the Navy primarily, some Marines that are helping with logistics, and some civilians that are part of this operation. They're fully stocked, fully staffed with every conceivable need you can ever imagine that resides within or around this floating hospital. As it relates to other hospitals, Seton, we were able to find staffing. St. Vincent, we're negotiating to create the framework to find staffing. All of these other individual skilled nursing facility units and all of these other motels, hotels have different staffing requirements. I'll be specific as it relates to the two that come up next week. These field medical stations, part of the 2,000 President Trump has sent to the state of California. The first two will be done in partnership with the state and county, and that's how we'll staff those first two. We're working with other counties and other jurisdictions on the other 6 in terms of how we staff. So it's a one-off, site-by-site determination, but the Mercy, fully staffed, fully operational.
When will non-COVID patients be transferred to the hospital? What precautions will be taken to make sure that
So yeah, this is an as they refer to it, as the Admiral refers to it, and he could speak more clearly, this is a COVID-free bubble. When we say bubble, it's the entire area around this site. The men and women that are on board are not going to be recreating nearby. There's strict protocols and procedures. No one can just randomly come off this ship. Everybody's being tested, and we have very strict protocols working with the county, Dr. Galley at the county level, in terms of managing those protocols within the county system to make sure non-COVID positive patients are making their way into this ship. This is an iterative process. It's a dynamic process. We'll start with a lower number of beds. In the extreme case, they have the capacity to go higher, including with ICU capacity. We're not looking for ICU capacity to begin with on the Mercy, and we are currently inventorying the ICU capacity throughout the entire state of California. But in the extreme, we're modeling just shy of 20,000 ICU beds through our May 20th modeling.
given that it's this is from Karen Luna from the LA Times. Given that it's Friday, we saw crowds farmer markets and beaches last weekend. Do you think law enforcement should begin issuing citations or tickets to people disregarding the state orders for persuading
I'm going to ask the mayor to speak to that because he's been leading with some novel strategies as it relates to not just citations of individuals, but encouraging businesses to do the right thing through regulation and licensing, which is exactly the kind of leadership we need. As it relates to state parks, let me just speak to this. We shut down an additional 59 locations, 98 total parking facilities now are shut down, primarily all along the coast, north and south. In order to reduce what we experienced last year in terms of the surge of individuals that were not practicing safe physical distancing last weekend. We'll see where things go this weekend, and to the extent we have to ratchet up the enforcement or do even more to shut down those facilities, we will do so in real time. Each city has different operations. Each city has different strategies to how they want to enforce and notify citizens, but LA's been leading on that, and I'll ask the mayor to talk more about that.
Thank you, Governor. First and foremost, with the beaches, I was glad to see the guidance come out from the county today in the order. It's something we will do on the one beach that we run in Venice Beach, and down here, actually 2 beaches, in Cabrillo Beach. We will make sure that that is the law and that is enforced. When I'm asked this a lot, I say, look, we've got an A in terms of compliance. If you look at the data, California, Los Angeles, in terms of the restriction of movement. 2, there's a lot of self-enforcement going on. My executive officer, an employee of mine, when she left her apartment today, had 2 people say, "What are you doing? Why are you leaving?" She said, "I work for the mayor." They said, "Oh, great, good, okay, you go." So there's a lot of that happening at the neighborhood level. Third, we use first and foremost our city employees, including our officers, to try to get adherence in a voluntary way, and that's the best way to move forward. We had one restaurant that tried to stay open, giving food to folks the first day we visited them with a police officer. That's over, and it hasn't reopened in terms of food service inside since. In those rare cases where we need enforcement, we're absolutely prepared, whether that's shutting somebody's power off at a business that shouldn't be open, or whether it's giving somebody a citation. In fact, we even found price gouging. Our LAPD officers found somebody selling hand sanitizer for $80. Let them know that that was illegal, and let them know that there's a criminal penalty. That hand sanitizer is now being sold for $7, or was sold for $7. So where we see that, we are prepared, but 99.99% of this can be done without any criminal penalty. But we're prepared if anybody is an outlier, because one person can be a super spreader. One person can kill someone. One person can kill themselves.
And I know that there's a constant drumbeat of inquiry as it relates to the National Guard. We have 500 National Guard men and women throughout the state of California only doing humanitarian mission, supporting our food logistics, primarily at our food banks. We have significantly increased our surge capacity through our state park system for state park patrol, and they'll be out in force this weekend with flyers, not citations at first, but again, we will tier our enforcement as necessary. I'll ask the director.
Yeah, Mark Ghilarducci, I'm Director of the Governor's Office of Emergency Services. The question had to do with how we are deploying our resources, specifically the CAL FIRE incident management teams. In reality, what we're doing is we're really been strategically planning for how best to utilize resources. And right now at this time, we've been providing all the different kinds of commodities and assets and support to local government. There has not been a specific need for an incident management team, but we have those in the wings, and we're ready to actually engage them when appropriate. We also are actively, while this is going on, strategically planning for and preparing for what obviously happens in California, and that is a wildfire season. And so those teams are actively, as we are sitting here today, working on that integrated approach to be able to deal with COVID-19 as well as protect our public in the event of a wildfire. So they're engaged, but at a different level at this time, and we'll engage them more as we need them.
Take a few more, thanks. This is time for partnership, not partisanship. As I said, open hand, not a clenched fist. He's our president, and every direct request that I've asked the President of the United States, he has been responsive and he has tried to accommodate. This is just one of many examples. Those 8 field stations, 2,000 units in the state of California, 2 that will be up and running next week. The Mercy are just examples specifically of that collaboration and that cooperative spirit. When it comes to emergencies, wildfires, disasters, we've always maintained those two-way conversation, that engagement, and we'll rise above the politics, and I'm grateful for that, and I'm candidly grateful for his leadership for the state of California and the issues and needs that we have requested and desires that have been met so far. And I'll keep monitoring that and keep prodding and keep encouraging for us to continue to do more and see more support in the future. Yeah, no, well, the total number of positives, 3801. I don't have a number of how many do not have residences that have come in. And clearly, as this data presents itself and we're able to break down those numbers, we'll have a better sense. But let me just say on the issue of homelessness, we have already procured, as of this morning, 4,666 hotel units that we are distributing throughout the state of California for prioritization at the county level for homeless individuals. We have, just in Los Angeles, the leadership of Mayor Garcetti and the county, they have identified that they are prepared to take 637 trailers that we were able to procure because of the leadership of Bob Fenton and Mark Gilladucci, and they're prepping those sites and preparing the resources that will be needed on site to meet that demand. So all of that's dynamic, all of that's happening in real time, and as you know, we distributed $100 million in emergency aid because of the leadership of Tony Atkins and Anthony Rendon and their colleagues in the Senate and the Assembly, and we distributed those dollars in emergency grants for homeless individuals to prioritize getting people off the streets, particularly seniors and those in encampments and those that are vulnerable disproportionately to COVID-19. So we have a lot of work to do in that space. It continues to happen in real time. Certain parts of the state, we're seeing more happening than other parts, and I've got a full-time team doing nothing else but prioritizing the needs of our homeless citizens as well. So we'll make a determination. We're still making a determination exactly how much. We've got $1.7 billion of that stimulus going for higher education. There's new assessment coming for K through 14. As I said, it's $8.3 billion, $6.9 billion for local jurisdictions, 8.3 that come in directly in block grants to the state itself. We've got transit money, $3.75 billion. We've got homeless money, $320+ million that's set aside for California directly out of that stimulus for our homeless programs. So we're assessing all of that in real time. We put out a new guidelines for our state budget just 48 hours ago, and we are looking at every single expenditure in our state. And all I can say is we will be making adjustments in real time, not waiting for the obvious, which is recognizing that there's a significant economic impact not only to the state but individuals, and we have to recognize that we've got to be here for the long haul. And the answer to the second part of that question is no, it's not enough. We're going to need more going forward. I know which one it's for. It's the mayor.
You sure? Okay.
Are there any concerns in terms of supplies and the drive-through testing now starting to pop up is taking up key supplies such as masks, gloves, gowns, hospitals and first responders as the surge comes?
No, is the short answer. The number of personnel on those sites is a small fraction of our medical personnel in hospitals, and we have made sure through the county. And if folks didn't catch that, 101 million masks this governor has helped to procure. There is enough. We're not worried about today. We're worried about surges in the future. We all know that. The governor said that we'll need more. I think he told us $1 billion is what you're looking at for gloves. We're looking at huge numbers down the pipeline, but absolutely not. Nor would we take those masks and PPE away from those who are doing testing. That is an absolutely critical role. That's stopping people before they get to the hospital potentially. That's keeping them, if they're okay, at home, knowing that they don't have COVID-19. But I'm proud that we've done about, I think as of today, 8,000 tests through those drive-through centers here in Los Angeles. That's about a tenth, I think, of the state's overall tests. And we're going to keep ramping that up and keep doing that. To the earlier question, we don't have one single confirmed person yet who is unhoused with COVID-19. I expect that there are people out there. But I want to pause on that for 2 seconds because a lot of people keep saying, oh, we don't want to have a shelter near us, or we don't want to have those people near us. Let's be clear, it's people who are housed who are infected first who would be giving it to people who are on the streets, not vice versa. So we really need to break those barriers down and think about each other as equals. All human lives matter equally, and I want to thank those city employees, those contractors from the nonprofits, and our county employees who are in our shelters and who will be at those motel and hotel beds that the state is helping us to get.
I will say that the PPE issue is, though, real. I mean, none of us are naive about the magnitude of the need, not just in our healthcare delivery system, but our grocers that are asking for more PPE support, our police officers, our front line out on the streets, sidewalks, our sheriffs, and we need to see more PPE, and we're doing everything we can for coveralls, shields, not just N95 masks, other kinds of masks and gloves. So as soon as it comes in, we're getting it right out, and I recognize exactly what the mayor is saying. We may have, for the moment, at capacity within our hospital system, but boy, around the corner, if these numbers continue, we're going to be searching far and wide for substantially more PPE. Well, we're getting close to 100,000 tests. I don't know how accurate that question is. We are seeing a significant increase every day in the number of tests. Our big issue has been for the 22 labs. I've been crystal clear for 2 weeks, lack of RNA extraction kits, lack of reagents. And now the big issue for us is swabs, specimen collection, specimen samples. I was talking to Stanford representatives, USC, Cedars, not just UC medical staff yesterday. They're trying to procure 3D printed swabs. We're doing everything in our power to do more. We're also looking at antibody tests, looking at blood-based tests, looking at different serums that could help advance the next generation of protocols. No state, by the way, is doing more in that respect at our labs in the state of California. The advanced trials with Gilead and Genentech and others, disproportionate number are happening in the state of California. So you're going to see those numbers continue to rise significantly, and approvals are coming in real time on a daily basis. With that, let me just thank again, Admiral. This is one hell of a ship, and you got one hell of a team. To the men and women that are here, thank you for your service. Thank you for your contribution. Thank you for saving lives. Thank you for meeting this moment. Thank you to the leadership assembled here, in particular, Mayor Garcetti. Thank you all very, very much. I know you want to say some things in Spanish.
Brevemente también en español yo quiero decir unas palabras con nuestro gobernador aquí. Y gracias, gobernador, por su liderazgo. Usted no solamente es el gobernador del estado de California, pero también de América. Y su liderazgo, su modelo de liderazgo, el primer estado en los Estados Unidos con estas acciones y órdenes, ha salvado las vidas de californios y también de americanos en todas partes de este país. Hoy le damos la bienvenida a USNS Mercy, este increíble regalo de la gente de este país al puerto de Los Ángeles. Un recurso poderoso y supervivencia en nuestra propia ciudad. Ahora tenemos 1,000 camas hospitalarias que no tuvimos ayer. Este es un aumento de 65% de las camas que están disponibles por la gente de Los Ángeles y esta región con esta barca. Y este barco es el hospital más grande ahora en Los Ángeles. Gracias a la Armada Naval y las Fuerzas Armadas de los Estados Unidos por su presencia y su trabajo aquí. Este puerto es muy familiar con estas Fuerzas Armadas, específicamente la Armada Naval, porque tenemos una historia muy grande, una gran historia de participación de nuestra gente en las guerras, en el pasado, estos barcos como el USS Iowa pero este es una representación no solamente de nuestro poder, pero nuestro corazón, nuestro cariño. Y gracias a todos, especialmente al gobernador, por su liderazgo y toda la gente durante esta crisis y esta lucha. Como una guerra, ganaremos esta lucha, ganaremos esta crisis también. Muchísimas gracias. Thank you.